Why are tumor markers important in testicular cancer surveillance? Imagine a tiny clue in your blood that can tell doctors if cancer is hiding or coming back. That's what tumor markers do in testicular cancer care. These are substances that the body produces in response to cancer, mainly human chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase. They are measured through simple blood tests, making them a practical way to keep an eye on the disease after treatment. After a person has had surgery to remove the affected testicle, doctors use tumor markers to check if any cancer cells are still active or if the cancer has returned. Because these markers can rise before symptoms appear or before tumors show up on scans, they help catch recurrences early. Early detection is key because testicular cancer is often very treatable when caught early. Tumor markers also help doctors see how well the treatment worked. If the levels of these markers go down or return to normal after therapy, it usually means the treatment was successful. But if the markers stay high or start rising again, it might suggest that some cancer cells are still present or that the cancer has come back. This information helps guide further treatment decisions, like additional therapy or more frequent monitoring. Different types of testicular cancer influence how much tumor markers are used. For nonseminomatous germ cell tumors, markers are very helpful and are routinely checked during follow-up. For seminomas, markers are less often elevated, so imaging scans play a bigger role, but markers are still useful especially in advanced cases. Blood tests for tumor markers are less invasive than biopsies and are cost-effective for long-term surveillance. Since most relapses happen within the first 2 years after treatment, regular blood tests help catch any issues early during this critical period. They are also useful for ongoing monitoring over several years, providing a safe way to track the disease without exposing patients to repeated radiation from scans. Tumor markers are part of a broader surveillance plan that includes physical exams and imaging tests like CT scans and chest X-rays. Combining these methods improves accuracy in detecting relapse and helps avoid unnecessary radiation exposure. While tumor markers alone cannot diagnose testicular cancer, they contribute valuable information for staging the disease and making treatment choices when biopsies are not possible. In summary, tumor markers are essential in testicular cancer follow-up because they offer a sensitive, non-invasive way to monitor disease activity. They help detect relapse early, assess how well treatment worked, and support personalized care. Following your healthcare team's surveillance plan and reporting any new symptoms promptly ensures the best possible outcomes. Always remember, medical decisions should be made in consultation with qualified healthcare professionals who can tailor care to individual needs.